11 years. That is the average gap between the day your thyroid started failing and the day a doctor figures it out. You are cold in rooms other people find comfortable. Your hair thins at the temples first. You sleep 9 hours and wake up exhausted. The day a doctor finally tests your free T3, the number on the lab will tell you what your immune system has been doing to the butterfly in your neck for the last 15 years. This is not aging. This is not stress. This is not winter. This is Hashimoto's disease, the most common autoimmune disorder in the developed world, running its 10th consecutive year of slowly dissolving a gland the size of 2 grapes that sits just below your collarbone. Most people with Hashimoto's will have it for 11 years before they get the right blood panel. Your TSH will come back normal 4 times. Your free T4 will come back normal 3 of those times. The lab that catches you, the free T3, gets ordered less than 10% of the time. Today we walk down all 7 stages of the immune system eating a butterfly. Stage 1 starts when your immune system stops recognizing your own thyroid. Your immune system is a database. Every cell in your body has a tag. The tag says, "This is you, do not attack." Most of your life, the database works. Sometimes, for reasons doctors still cannot fully explain, the database makes a mistake. The mistake usually happens after a viral infection. Epstein-Barr, Coxsackie virus, COVID-19. The virus has a protein that looks almost identical to a protein on your thyroid. Your immune system kills the virus. Then it keeps killing, because the thyroid protein now looks like the enemy too. This is called molecular mimicry. The first time it happens, you don't notice. The immune system kills a few hundred thyroid cells. The gland makes more. The lab is normal, but the immune system has learned a pattern. The pattern is in its long-term memory. It will not unlearn it. You are now what doctors call an autoimmune patient, except no doctor will tell you that for years. Your TPO antibodies, thyroid peroxidase antibodies, are now climbing above 35, above 100, above 500. None of these numbers will appear on a standard blood panel. The first stage is the immune system writing your name on its list. Stage 2 is when the antibodies start accumulating. TPO antibodies bind to thyroid peroxidase, the enzyme inside your thyroid that converts iodine into thyroid hormone. Each antibody jammed onto the enzyme is one less thyroid hormone made. Your thyroid notices. Your pituitary notices. TSH rises slightly to compensate. The gland enlarges. You may notice the goiter. You may notice you cannot button your top shirt button. Antithyroglobulin antibodies start appearing too. These bind to the stored form of thyroid hormone that is supposed to wait inside the gland until release. The antibodies say, "Release this now," and destroy it. This stage can last for years. 3, 5, 10. The antibodies climb. The gland tries to keep up. Your labs look normal. TSH within range, free T4 within range. Because the gland is overproducing to compensate, you feel periods of energy followed by exhaustion. The energy is the gland dumping stored hormone. The exhaustion is the gland recovering. This is sometimes called hashitoxicosis, the brief hyperthyroid phase before the gland gives out. Anxiety, heart palpitations, heat intolerance, sleep loss, weight loss for no reason, then the gland runs out. Stage 3 is when the immune system enters the thyroid tissue itself. Lymphocytes, T cells and B cells cross from the bloodstream into the thyroid parenchyma. They form clusters around individual thyroid follicles. Each follicle is a tiny round structure containing stored thyroid hormone. When pathologists look at a Hashimoto's thyroid under a microscope, they see what looks like the gland being invaded by an army. Dense aggregates of lymphocytes, called germinal centers, form inside the tissue. These are the same structures that normally form inside lymph nodes when you fight an infection. Your thyroid is being treated as an infected lymph node. The lymphocytes release chemical signals, cytokines, with names like interferon gamma and IL-12. Think of them as flares. The flares call in the cleanup crew. Macrophages, the immune system's demolition cells. They arrive at the follicles and start tearing them open. A few follicles disappear every day. The gland is still able to produce most of what you need. Your TSH might still be normal. The damage is invisible to a standard blood panel, but if your doctor ordered an ultrasound, they would see something now. The thyroid would look mottled, hypoechoic, lumpy, not smooth and homogeneous like a healthy gland. Most general practitioners do not order an ultrasound. By the end of stage 3, an average of 15% of your thyroid tissue is gone. Before we move on, 3 stages in, your immune system has learned to attack your thyroid. The antibodies are climbing. The infiltration has begun. 15% of your gland is already gone. And here is the part that breaks people. The next 4 stages happen while your blood work still reads normal. Stage 4 is the year that quietly ends. Here is the cruel part. You do not know any of this. Most labs your doctor orders catch none of it. The TSH is the only thyroid test most doctors order, and it has not started rising yet, because the damaged gland is still overproducing what is left. This is the stage between 3 and 4 that most patients live in for years. You feel slightly worse than you used to. You attribute it to stress, to age, to winter, to the new job. You eat more vegetables. You start magnesium. You stop drinking coffee after noon. Some of it helps, some of it does not. You do not know that what is happening inside your neck is an autoimmune disease running its slow course. The next 4 stages are what happens when the overproduction runs out. Stage 4 is the year your TSH starts climbing. Here is the trick that costs people a decade. The normal TSH range, 0.4 to 4.5, was built from a population that already included undiagnosed Hashimoto's patients. Strip them out and the real ceiling is 2.5. Everyone between 2.5 and 4.5 is told they are fine. Most of them are not. Stage 4 is your TSH crossing 2.5, then 3.0, then 3.5. Each crossing represents thyroid cells the immune system has finished killing. Your pituitary keeps shouting, "Make more, make more." The shrinking gland has fewer cells available to listen. You feel a new kind of tired. Not sleepy, tired in your muscles, tired in your skin, tired in your hair, which now sheds when you wash it. Your body temperature drops half a degree. You start needing a sweater in rooms that used to be comfortable. Your skin produces less oil. Your nails crack. The outer third of your eyebrows starts thinning. A sign so specific it has its own name, the sign of Hertoge. Stage 5 is the diagnosis that should change everything, and usually changes nothing. Your TSH crosses 4.5. Your doctor calls it slightly elevated. They retest in 3 months. By the retest, the number is 5.2. This is subclinical hypothyroidism. Subclinical because the free T4 is still technically within range. Hypothyroidism because the gland is failing. The American Thyroid Association says levothyroxine should be considered when TSH is above 10, or when symptoms are present at any elevation. Most doctors wait for the 10. Read that again. Your TSH has to more than double the real ceiling before the standard of care lets your doctor write the prescription. In the 5 to 7 years it takes to get there, here is what your body does. For 5 years your TSH will sit between 4.5 and 9.9. You will gain weight. You will sleep 10 hours. You will go to bed at 9 p.m. and wake at noon and not feel rested. Your free T3, if anyone bothered to order it, would already be at the bottom of the range, around 2.3 picograms per milliliter. The reference range bottom is 2.0. You are not below range, you are at the floor of the range. You are functionally hypothyroid. You are clinically untreatable. This stage averages 5 to 7 years before a doctor finally gives you levothyroxine. 1 year of Hashimoto's is a thinning at the temples that you blame on age. 5 years is a weight gain you blame on the office sitting and a brain fog you blame on phones. 15 years is a heart that beats more slowly than it should, cholesterol that climbs every year, and a low-grade depression that no SSRI has touched in 3 trials. Here is where we are. The immune system found your thyroid. The antibodies climbed. The lymphocytes moved in. The gland started shrinking. The TSH crept up. The free T3 fell to the floor of the range. You are now 5 stages from the start, and the next 2 stages are when the slow damage becomes structural and your daily symptoms become permanent. Stage 6 is the year the destruction becomes irreversible. The lymphocyte infiltration has progressed to the point that more than half of your thyroid tissue has been replaced by lymphocytes and scar tissue. The thyroid is now visibly atrophic on ultrasound, half the normal size, fibrous, fragmented. Pathologists call this state Hashimoto's thyroiditis with marked atrophy. It is a permanent change. The destroyed follicles do not regrow. At this point, you are almost certainly on levothyroxine, synthetic T4. Most patients are. The drug is cheap. It works for most people. For you, only partly, because the body has to convert T4 into T3 to use it. That conversion happens through an enzyme called type 2 deiodinase in the liver and other tissues. The enzyme can be inhibited by stress, by inflammation, by low ferritin, by low selenium, and by high cortisol, all of which you have, because you have been chronically autoimmune for a decade. Your TSH on levothyroxine looks normal. Your free T4 looks normal. Your free T3 is still at the floor. You still feel terrible. Your doctor tells you your thyroid is well managed. Stage 7 is the final stage of Hashimoto's thyroiditis, and the moment the thumbnail makes a promise, your thyroid is now mostly scar tissue. The gland has shrunk to the size of an almond. Real cellular thyroid tissue is maybe 10% of what you were born with. Your TSH is whatever your levothyroxine dose tells the lab. Your free T4 is whatever your levothyroxine dose tells the lab. None of these numbers reflect what is actually happening inside you, but your free T3 is your body's actual usable thyroid hormone level. The thing that warms your cells, runs your mitochondria, regulates your metabolism, builds your hair, holds your skin elastic. The free T3 of an average treated Hashimoto's patient at year 15 is around 2.0 to 2.4 picograms per milliliter. The bottom of the reference range. The floor. This is the missing peak. This is what the lab will tell you the day a doctor finally orders the right test. This is what 15 years of slow autoimmune destruction looks like on a sheet of paper. This is not a thyroid that has failed acutely. This is a thyroid that the immune system has eaten, slowly, for as long as you have been an adult. And here is the part no doctor will tell you in stage 5 or 6. It does not have to end at the floor. 7 stages. Recognition, antibodies, infiltration, function decline, subclinical, tissue destruction, floor, and the line connecting them is one immune system, 1 decade, one set of behaviors that either accelerated this or could have slowed it. The recovery from stage 7 is not full reversal. The dead follicles do not regrow, but the inflammation can be turned down. The conversion from T4 to T3 can be restored. The remaining gland can be protected. The autoimmunity can be quieted. The behaviors that move free T3 from the floor toward the middle of the range are well documented. Selenium 200 micrograms a day. Eliminate gluten for 90 days and retest TPO antibodies. Sleep 7.5 hours in a cold, dark room. Walk after meals. Get morning sunlight on your face. Add T3 to your replacement protocol if your endocrinologist will write it. Most will not. Most should. That last one matters. You are not the person whose thyroid was eaten. You are the person whose free T3 is on the way back up. Subscribe. The next stage of this story is your pancreas, and stage 1 of that breakdown is happening right now, in the same body, for the same upstream reason that started the thyroid breakdown a decade ago.